Hi, I'm Charlie Sauer, president of the Market Institute Foundation and editor of U.S. Policy. You might be wondering what that board is back there, and we'll get to that in just a minute. But first, I want to talk about why we're here. You see, the Mercatus Center recently published a paper, and it includes the HOPE Index, the Health, Openness, and Access Project. It's full of lots of great information. They look at all 50 states, and they score each state on 41 variables. The problem is, it can be hard to understand, but I had an idea. The idea I had was to build this large Plinko board, and it was an adventure. There was 3 prototypes. There was 30 hours of building, 100 hours of 3D printing using 2 kilograms of material. There was a bottle of glue, 2 rolls of tape, 6 cans of paint, screws, nails, blood, sweat, tears. But the final product, glorious. And the results, mind-blowing. The idea of the HOPE paper is pretty simple. The more regulations and barriers you put between a doctor and a patient, the less access to healthcare there is. Or in other words, if we look at the board, if we were to drop a ball from the top, it would go straight to the bottom if no barriers were in place. But once we put barriers in place, that ball takes longer to go from the top to the bottom. But you don't have to take my word for it. Let's look at some of the results from the 50 states. The HOPE Project's 41 variables were divided into 5 categories, just like you can see on our board. The first category was professional regulation, and it had 10 variables focusing on medical licensure to scope of practice. The second category was institutional regulation, which has 6 variables in it, looking at things like certificate of need restrictions and provider taxes. The third category are patient regulations, and that again has 6 variables in it, and that's looking at ideas like access to CBD oil or access to oral contraceptives without a physician prescription, or again, taxes. The fourth category are payment regulations. This has 9 variables from the report in it, and we're looking at mandated insurance benefits all the way to the restrictions on short-term renewable plans. The 5th category is about the regulation of the delivery of healthcare. And in this category, we have the last 10 variables at the report, looking at the idea of payment parity for telemedicine, allowing direct primary cares to dispense drugs, or not treating direct primary care practices as insurance. Now that we've seen the board in action, let's take a look at 2 states in particular. New Jersey, the worst performing state in the index, and Colorado, the best performing state in the index. Now I'm going to slow these 2 videos down so we can really see what's going on. But as you see, as I drop the ball, they both start off pretty much similar. But then Colorado makes a fairly quick trip to the bottom, while New Jersey is spent spluttering around from regulation to regulation before finally reaching the bottom. Now, I said the results of this project were mind-blowing, and honestly, I think they are, because we were able to almost exactly mimic the results that the HOPE Project got as well. But I have a secret, because I honestly don't think this result is that mind-blowing. If you put barriers in front of something, it takes longer to get there. But the result also shouldn't be mind-blowing in healthcare, where more barriers and regulations restrict access to healthcare. They slow the doctor from getting to the patient. They make it harder for patients to get access to the doctor. That isn't what we should want in public policy, and it's not what we should want moving forward as a solution either. But I have some good news about that. You see, the results for the HOPE Project were compiled before the coronavirus pandemic. And since then, states across the country have been removing regulations and removing barriers, making telemedicine easier, removing certificate of need laws. Things have gotten better in the states. Barriers have been removed from our board, and access to healthcare has gotten better. This is important for us to know going forward, though, because we don't want our legislators to put the pegs back on the board and again make it harder and restrict access to healthcare. If you like this video and you want to see more like it, please hit that subscribe button, hit that like button, and if you have an idea for a public policy that you would like to see visualized, please leave a comment below. Thank you for coming.